When it comes to KALON WEST, yes, I am the sole practitioner as it exists today, but I do have a background team formulating. So you will get to visit with me. My name is Richelle Voth. I'm a physician assistant. I have been a physician assistant since 2014. Started practicing in the very beginning of 2015, 2014 is when I graduated from OU Tulsa, Oklahoma University, here locally, if you know the Oklahoma terrain. And I see patients that are based in Oklahoma. So what does that mean? It means that if you live in Michigan, I unfortunately cannot see you. You would have to travel into the state of Oklahoma, and you can sit in your car at the border line and we can have a telehealth consultation and that will qualify. But right now my license only exists for me to be able to see Oklahoma located clientele. Now, a lot of what I do will be telehealth based simply because that's ease of access to you and it's very convenient. There will be a brick and mortar up and coming, but as it is today, telehealth consultations are the way to come into the terrain of KALON WEST with me. And I look forward to working with some of you in multiple different experiences. And telehealth is really a unique platform these days because I've been doing telehealth for the last 3.5, almost 4 years now. Before that, my experience was all in clinic and in hospital venue settings, also in rehab centers and wellnesses. Along with skilled nursing facilities, and then what you call an LTAC, long-term acute care facility. So I've really had a large repertoire of experiences when it comes to not only every flavor of medicine that you can kind of step yourself into if you have some type of chronic illness or catastrophe, but then I moved into outpatient world, more predominantly private practice, and that existed primarily in the telehealth space because of the pandemic provoked challenges. And so that's unique because telehealth, I can't necessarily touch and feel here, but I can see for the most part. And you have to develop a different way of asking questions in order to sleuth down to certain decision points on that decision tree when it comes to accurately diagnosing and treating people that need help. And to be fair, there are some conditions that you really can't maneuver in a telehealth way. And so I will always be upfront about that and open and honest because I can't hear your heart. I can't necessarily listen to your lungs and I can't get the feedback from the biomechanics of your body. However, I have the repertoire of doing that for the before private practice scenes of at least 8 to 9 years. And so I am well versed in what questions to ask surrounding that. And I will oftentimes ask for medical records if there's something that's very unclear. And yes, we can meet in person. I'll talk about how that works later. But for the majority of the clients with KALON WEST right now, it will exist in a telehealth capacity. So what is the process of getting a KALON WEST appointment? Good question. I know you didn't ask, but I threw it out there for you. The way you can get to know us would be one, visit our website, www.kalonwest.com. And on there will be a book consult button. And if you click that button, it will pop you open to a scheduler and it will have open appointment visit slots for you to have an initial consultation with myself or a member of my team. It's about 20 minutes is what you'll need. And it will just be a get to know each other, no cost to you type of conversation that will see if your needs fit what we can offer for you. So that is free to you. Nothing that you need to bring up front, not even really a medical history form to fill out. You just get a free appointment so we can see if we're best fit for each other. And if you are, then during that call, we will send you a link to our patient portal and our virtual back end. We will ask that you fill out some forms, some more medical information and things, and we will book you an appointment on that 20-minute, let's call it a discovery call of who you are and who we can both be together if we're the right fit. And we'll book you an appointment that will then trigger visit emails and text messages so that you remember and have the link to be able to have the two-way street telehealth appointment with myself. So that's the best way to get a hold of us right now is to go to the website www.kalonwest.com, click book consultation, and then book your free discovery calls, what we'll call it, between you and me. And then we will get to know each other, see if we're the right fit, and move forward from there. We will talk about pricing. We will talk about next steps. We'll talk about lab work and how we get that done if it's needed. But that is the best way to integrate yourself and to come in through the doors of KALON WEST at this time. And as that upgrades or changes, feel free to reach out. We will let you know about more.